We're now live. Live number 72. Had to take a week off. A lot of traveling the last 2 weeks, back and forth here and there. Yeah, the licensing issue. So TikTok Live number 72. By the way, the top 5 listeners to stay on for most of the podcasts. TikTok tells me that, okay? So I'll be giving you guys a shout out in the caption of YouTube and podcasts. All right, let's begin. Cool Bud said, did you get your license yet? I haven't got my license yet. I did receive an email today saying that it should arrive within 10 days. Okay, so 10 business days. So we're looking at September 1st. Better, not great, but better, I guess. Zayada3 Mur said, sup. The dog with the white fur with the patch along one of the eyes said, yo, what's going on? I can't see the name of who that is. So sorry about that. Number 1 said, I am the student that asked for advice between which one I should pick, 6-year term or 4-year residency. Yeah, well, let's get into that. Why not? Let's actually chat about it. What do you think? Let's go again. What did you decide? What did you think about? Let me know where you're at there, friend. EE said, how did med students treat you? I mean, I didn't work with too many med students. I was mostly working with medical residents. I mean, I guess med students in dental school, we worked with a couple there. Yeah, but that was mostly my classmates. So no, I didn't see med students too much. Medical residents generally fine. There's just one, like there'd just be one out of maybe 20. It was very rare. Maybe 1 out of 20 would be very condescending. But yeah, generally, and I didn't care. Like I just didn't care how they wanted to act. P said, will you allow students to shadow? Absolutely. Yeah. You want to shadow? Green Dinosaur said, do you advise me on switching from dentistry to medicine? That's a choice you need to make. I can't make that for you, man. Zayada3 said, Doctor, can you make a video on how dentists in other countries come into the U.S. and work as a dentist? I did. Absolutely I can. I did already. You got to find it. It's like an Easter egg hunt, right? You got to find the hidden gem. Yeah, there is. In fact, I made one in Spanish as well. Yeah, so it's there. You can find it. P said, can I shadow you? Yeah, man. Once I get my license, once I get my feet on the ground, I'm working. Even better would be after I take the boards in January, because before then, I'll be heavily studying for the boards, in addition to working, in addition to moving to the house, paying off the mortgage, whatever we do. Oh, in a little fitness center area in the garage. So, did you check it? Yeah, 30 minutes. My thing is 30 minutes. I go at 7:30. It's only 5.
What that was 7?
7:30. Melanin said, can I shout you as well? Yeah, what's up, Melanin? Of course. Sorry, I'm good. That's the door in the background. Sorry about that. Okay. P said, I'm a student at Stony Brook University. Oh, no way. I went to dental school there. You probably know that. Yeah, come through. I'll be in Melville starting whenever this license come in. I'll probably be going in like next week or something. Yeah. Trey, what was your CBSE schedule like with clinic? Great question, Trey. So with clinic, my CBSE studying was, clinic would start at 10, but we had class from 8 to 10. So this is how I studied for the CBSE that last month, right before I took that exam in February 2018. I would get up at like 5:36. I would do a quick block, timed, not in tutor mode, and then I would draw immediately while I was like having breakfast and everything. Then I would immediately drive to class, 8 to 10. Clinic was 10 to 1. That from 1 to 2 was lunch. I was eating and studying, reviewing what I got wrong on that first block, UWorld question block, right? Of the UWorld question bank. Afternoon clinic was 2 to 5. As soon as I got out, I would speed all the way over to Panera Bread, because we didn't really have like a real library at Stony Brook Dental School, so I needed to focus. I would go to Panera Bread. I would leave my phone in the car. I didn't have the iMessage hooked up with my laptop. I would put on my noise canceling headphones, and then I would listen to progressive house 2-hour mixes with no vocals, just the progressive house melodic house mix, and then I would do just blocks after that, reviewing what I got wrong. But now, at the end of the day, when you're tired, it was just a 12-hour day, then I would do tutor mode. So in between every question, then you study that thing. Okay, that's how I studied for the CBSE that final month, and that's what got it for me. All right, P said, yes, please, thank you. Yeah, man, you got it. P is in the library at the Health Sciences Tower. Yeah, I studied there for maybe like 6 months or so in my first year dental school, D1 year. But I don't know, I just felt like the library, it was a waste of time to drive all the way there when I don't know, it just didn't do it for me. That's the med students library. It's not our library, so we didn't really feel, I don't know. You know what I mean? Something. Tips on handling D1 year. Yes. Effective and efficient studying. Effective studying is getting higher grades, but then efficient studying is maintaining those higher grades, studying less and less. And the way I figured that out for me was Quizlet version, with the premium version using Quizlet premium version with figures on every single card, and the cards I would make question, answer, A, B, and C, but no more than that would be too much, okay? That's how you handle D1 year. Adam Mustafa 95, freshman and undergrad. I'm starting freshman year. Congrats, Adam. Yeah, it would be the same thing as D1 year dental school. The earlier, the better. Maybe you use Anki, maybe use Quizlet, maybe use Brainscape, maybe use one of those other things. Just figure out what works for you, and I highly recommend using technology. I used to write everything out. That takes way too long. This is 2025. We have technology. That's good. We have AI at our fingertips. Use that. Study that. I think cards is the best way to go. I really do think so. Bieri said, also, when should you start studying for the CBSE? I'm a D2. Yeah, I would think about it right now. I would start thinking about it in D2 year. You should start studying for that CBSE soon. Okay, you should start starting for it. Okay, generally I recommend taking that CBSE before you study for it, like hard course. I don't know if you took it already, but yeah, start thinking about it now. Hopefully you have your grades, your classes down. As you add in clinic, okay? All right. Steve-O said, what do you look for in a man? Steve-O said, what do you look for in a man? I don't know. I'm not really looking for qualities in men. Okay. That's really funny, though. Yeah, so Trey, that's what my CBSE schedule is like in clinic. Lady Avalon said, I have dry socket. Does this mean no bone will form then? No, that's not what it means. It just means that your blood clot dislodged a little bit too early and the body didn't anticipate losing it. So you have some exposed bone at that time. That's really loud. That door's really loud, by the way. Just saying. It's really loud.
I know.
Okay, so we've got a really loud door, but this is the accommodation we have to go by right now. Akshat said, how important was the state tuition when you were choosing dental school to attend class size? Class size was more important to me. I knew I was very interested in specializing, but smaller class sizes generally get better clinical attention, hands-on with the attendings, which is very important. You're a dentist. All these tests and exams and didactics and PowerPoints are great, but you need to know how to do dentistry. The best way to learn how to do dentistry is obviously getting hands-on, and you need some one-on-one attention with the faculty. That's the only way to get really good at dentistry, right? Practicing, and the more you practice with the supervision and help from a mentor, from an attending, from faculty, the better you're going to be, okay? What's next? What's next? Ash Arnold, is it hard to retain a lot of knowledge? Well, it's going to be different for everyone. Generally, I'd say, yeah, a lot of knowledge is hard to maintain, but by consistently getting repetitions over time, it'll help you remember more and longer. You know what I mean? Does that make sense? All right, friends, let's get after it. Kwame A said, how do you balance work and life during residency? You don't. Yeah, you do. You have to make time for it. You have to find your routine. I think getting in a routine and a schedule that fits you, that helps everything. That helps de-stress. That helps manage stress, pressure. Maybe you get up a half hour early and do things before you head in. That's something that helped me out big time. As soon as I get home, I don't dilly-dally. Talk about the day, put up a post, and I go right to the gym and work out. Or studying. Sometimes you have to study for the OMFS, and I wasn't working out as much. I would go and do that. Things like that, okay? You need to maximize your schedule. You really need to get in a good routine, okay? Another thing is to-do list. Figure out what you need to get a good to-do list that you like to use. I like to use an app called To-Do. It's a white app with the blue check on it by Microsoft, and you just prioritize everything you need to get done and start getting it done. Don't signal to noise ratio. Focus on the signal. All the noise is distractions, and you need to keep going. Okay. Jane Salt, oldest student in dental school. In dental school, she was about like 33 years old when I was like 23. Maybe she was 35. She might have been 35. And then in residency, oldest resident was 48. Graduated at 48 years old. Yeah. How about that, huh? Royce Lee said, hey, joining late. Did your license come in yet? It didn't come in yet. It didn't. I did get an email today saying that I'll get it within 10 business days now. They finally found all my application materials and documents. They submitted it for the licensing queue. They said I'll get it within 10 business days. So I've been watching my email all day long, and it's going to be a while, I'm sure, again. But it's better. That's it's a step in the right direction, I guess. Tree said, hi, I'm from Morocco. I plan to study dentistry in Spain and then go for the advanced program. OMFS possible? It might be possible. I don't know how dentistry works in Spain. I'm here in New York, in the United States. And unfortunately, I don't know what's going on over there in Spain. M. Lady Avalon said, so will I get bone? My surgeon didn't do a bone graft, though. So will it be hard to get an implant? Look, I don't know your medical history. I don't know your age, and that does affect healing pretty substantially, right? Older people in their 80s, yeah, they're not going to grow back bone. Their socket where the tooth came out isn't going to fill up as much at all, potentially at all. If you're younger, more healthy, you got good blood flow to those areas. That's another thing. Comorbidities, smoking, right? Tobacco smoking, diabetes, that's going to affect how well you heal and fight infection, believe it or not. So those are something to consider. If you're younger, healthy, yeah, you're probably going to get some bony fill. It might not be 100%. It's probably not going to be 100%, but you might get 50% or more, this is not medical advice, in that socket as it fills up with bone. And we don't always bone graft sites with bone. You should ask them why they didn't bone graft, okay? I wouldn't be able to give you that answer. I haven't reviewed your x-rays or, your oral cavity. I wouldn't be able to give you a fair answer. You know what I mean? Jane Salt. Jane Salt said, thanks. You got it, Jane. Summer. OMFS is a lot of blood. Did you always have tolerance for blood? If not, how did you get used to it? I did not always have a tolerance for blood. The story is, the first time I went to get blood drawn, it's like 5, 6, 7 years old. I think it was like 5 years old. I went with my dad, and I saw him get his blood drawn first. I got like woozy. I had to sit down in a chair. Since then, I've generally been okay. There might have been one time I was in my first OR case, and it was a scapula flap to, I think it was the left mandible. And it was a lot, and I never saw that before. But, as you get your reps up with anything, you generally you build a tolerance to it. You know what I mean? So you will do it. Summer, you can do it. It takes time. Give yourself time, right? It's not like overnight. You're just fine with things. Mark YGTM, when there is a will, there's a way, but the price may be too high. Thanks, Mark. User 5003, would it be crazy to study and take the CBSE before starting dental school during a gap year? Yeah, that would be crazy. I wouldn't recommend doing that. The material you study is going to take forever to learn. You didn't learn it in like a course structure yet, and you're not going to retain that much. I would use that gap year to work, make some money, see some friends, see some family, travel a little bit, explore your hobbies. That's what you should be focused on in your gap year, not more tests. This is your opportunity to get away from the tests and get an idea of what the real world is like outside of this whole educational system. And that's going to last you a lot longer. If you do that, if you explore and you push to find out what this world is about, you're going to learn a lot more in that time, and you're going to take it with you. Okay, that's very important. M. Lady Avalon, can a dry socket migrate to the tooth next door? 41? No, it can't. Dr. Aaron Sheffield, hi, Doc. Hey, Doc, how you doing? What's going on, man? User 5003, follow the live creator. Thanks, man. Thanks, friend. Dr. Aaron Sheffield said, I'm a fainter. Yeah, right, like early on, some of us do that. Some of that happens sometimes. I didn't fully faint. I had like a little vasovagal just watching my dad get blood drawn. And didn't happen after that. It's going to be okay. You know what I mean? Like it's I think some people get like pushed away from surgical professions because of that. And it's actually not, I don't think that's a telltale of like why you shouldn't go into surgery. You know what I mean? Tree said, no, I was talking about studying first in Spain and then coming to the US. Will I still have a chance? Yeah, you'll have a chance. It might take some time. You're going to have to do an additional 2 years of dental school, like redo 2 years of dental school, 2.5 in some institutions now, and then try and get your citizenship through that time, and then apply to residency there in oral surgery. Okay, it's a long route. I wouldn't do it that way if I were you. And you know what? Spain apparently has a really good health system. If you're going to go to dental school there, maybe you want to look into that. I think they actually support their providers really good there. So, something to think about. P, I sent you a message on IG about shadowing. Sweet, yeah, IG. Did you just do it now? Good. I'll get back to you in the coming days. Vlada_IW, does it look bad on you if you quit the job on the first day? I don't know. Probably doesn't look too good if you quit your job on the first day. You're not going to give it a week. But hey, I mean, you got to do what you got to do. If you're walking in and quitting within 20 minutes, I mean, at least get a cup of coffee before you walk out, right? You got to use the bathroom a few times, give an extra couple flushes. No, don't do that. Anyway, Daniel Smith. Hey, I'm looking to become an OMFS. I'm currently in 11th grade in Canada. Do you have any tips? Yes. Excellent. I'm glad you have that ambition. Go for it, but let's start one at a time. In 11th grade, you're in high school. You got to go to college first. You got to maintain good grades and everything. Shadow. Make sure you're shadowing a variety of specialties in dentistry and maybe some physicians as well. That gives you more to talk about on the interview, and it gets to show you, yes, this is what I want to do, or no, this is not what I want to do, okay? Next, college, DAT. After the DAT, that's your admissions test to dental school. You go to dental school, then you take other exams and stuff, good standings and stuff, okay? So let's just take it one at a time, Dan. And that's going to also ease some of the imposter syndrome stuff or the anxiety or the stress, okay? One at a time. That's a really good thing. And when you're in dental school, you're going to go back that too. One at a time, prioritize the things that need to come first, all right? Dr. Aaron Sheffield, like the live. Thanks, Doc. Thanks, Dr. Aaron. Dr. Aaron said, it's not that big of a deal. I was glad my faculty made it a non-issue. That's another thing. You know, sometimes faculty members, they're so immature. Grow up. It's not that big of a deal. Treat everyone equally. Make sure everyone has an equal opportunity to do what they got to do, right? Whether maybe it's in dental school, right? And the dental student kind of faints a little bit during the surgery, extracted a tooth, whatever. That's not uncommon. That happens all the time. It really pisses me off when these people bottleneck us into thinking that it's one way or the highway, and that is not true in this world or in this lifetime. You know what I mean? Anyway, let's move on. Dr. Aaron Sheffield going to Amos. So I just looked at dates, and because I haven't started working yet, it's literally going to be like I work a week and then leave, or 2 weeks and then leave for Amos. That's not good. That's not going to look good. In fact, we have a company dinner on that Wednesday too. So it's not looking good this year. And then with board studying, I need to take some days off to do the course for that. So, excuse me, unfortunately, Dr. Aaron, it's not looking good for Amos this year just because of the waiting on the license. I still haven't got my diploma. Waiting on the license, they said within 10 business days I should get that. So you see what I'm saying? Around like September 1st, the latest I'll start. And then Amos is like 2 weeks after that. You see what I mean? It's not looking good, unfortunately. I don't think I'm going to be able to make it this year. And I love Amos. You know, that's where we met in person. And yeah, so I gotta figure that out. EJ and Jean, how long did you study for the DAT? A month and a half. I studied for the DAT. Trevor Vigian said, started medical school today. Congrats. What's one thing I should look to do in the first few weeks? Get down your study method. Effective and efficient studying. I used Quizlet, the premium version, with the figures that you can put on it. That's what I would recommend. You got to find what it is. Is it Anki? A lot of med students are using Anki. At least they did 8 years ago when I was in dental school. Something to think about, okay? Hassan said, just started my D1 year. Congrats, Hassan. Well done. What school you at? What school are you at in D1? Dr. Aaron Sheffield, it's not that big. Yeah. Pete, yes, that was me. Thank you. Yeah, Pete, you got it, man. Summer, I'm starting dental school in like 2-ish weeks. I want to become an oral surgeon. Well, congrats. Start dental school. Let's work on those grades. If grades are going well and you're able to manage that on top clinic, take the CBSE. Once you crush that CBSE, we'll talk about externships, and then you'll apply from there. All right? You're going to be just fine. Just keep pushing forward. It's going to get stressful at times. Don't listen to the noise and distractions around you. Focus on your goal, okay? That's the biggest thing. Just keep pressing forward on your goals. Solino Milo, I'm a freshman undergrad. I'm also an oral surgery dental assistant. Do I keep shadowing OFS or dentist? Whatever you want. You're working there, so keep working. I mean, if you work there, that's just as good. Maybe that's even better than shadowing, right? Because you're actually hands-on. You're doing stuff. You know what's coming next in the surgery or the procedure. That's even better. I would continue doing that. But during dental school, see how you do. See how you do with your grades, tests, ranking. Let that tell you whether you should continue or not. You know what I mean? User 50036. What undergrad/dental school did you attend? Undergrad, I did 2 years at NYU Polytechnic Institute of Engineering. That's now NYU Tandon School of Engineering. After sophomore year, they cut the basketball program, so I transferred to Stevens Institute of Technology. That's in Hoboken, New Jersey. Graduated from there 2 years later. Then I went to Stony Brook Dental School. That's on Long Island in New York. And then after Stony Brook Dental School, I went to NYU and Bellevue Oral Surgery Residency. And now I'll be working at All County in the Melville office starting when my license comes in this next 10 days. And that's on Long Island. Connor Yamsek said, I mean, the vibes are off and you see unethical practices. I see why people wouldn't. Neil Amin said, applying to GPR, getting interviews right now. What is your advice for interviews? An interview is a conversation. The biggest thing is that it's not a multiple choice exam. So you're not going to be preparing this thing, looking at cards or question and answer and stuff. You should really be thinking about like, what's some commonality? What are some topics that are common to you and who might be interviewing you, like playing an instrument, like sports, like fishing, hobbies and sports and outside interests, right? You're going to answer whatever questions you have that they give you, right? But make it conversational. You can ask questions too. The biggest thing is don't treat that like a multiple choice exam, okay? That's going to be the biggest thing. All right, conversational. If you need help, you could read the book by Dale Carnegie, How to Win Friends and Influence People. It's a great book and it tells you how to kind of talk with people, how to converse. All right, good luck, Neil. Dr. Aaron Sheffield, yeah, not worth it. Dr. Aaron said, I wasn't that excited to go anywhere. Oh no, but I'm very excited. I would love to go. I gotta, it's not gonna look good if I start working and then 10 days later I'm leaving for Amos, you know what I mean? That's the only thing. And then you said, what's the deal with the diploma? I don't know. We're the professional students of the university. The undergrads got their stuff. The dental students got their diplomas. They haven't sent it out to the residents yet. For all of NYU? Shouldn't they be sending these out first? Because we actually treat patients. You know, if you just graduated undergrad, you're not treating patients. If you just graduated medical school, you have to go to residency. You're not treating patients. Dental students, they might be treating patients. So maybe, but residents that graduate are directly treating patients. We need to work. We need to pay the bills. So there's something really off with the graduating residents getting their diplomas last. There's something that it doesn't make any sense. Someone mentioned that it might be because of insurance companies. If you think about it, patients pay whatever they're getting, right? An insurance company may tell a big institution like this, like, send out these diplomas later. Because technically I could have started working on July 1st if they sent everything out in time, right? July 1st, August 1st, and I already know I'm not going to be starting until at least September. So that's 2 full months that insurance companies continue to get payments, but there aren't additional providers from it, like NYU, for example, out. So that's what someone told me. I don't know how true it is. It would make sense for these insurance companies to find another slimy way to make more money. But yeah, anyway, leaving my trying to leave my personal thoughts out of it. User 3141. Do you like One Piece? What does that mean? GMFFL. Have you ever worked with CRNAs? I have worked with CRNAs. CRNAs are great. I haven't had any bad experiences with CRNAs. Only good experiences. Tree said, one CRNA actually made fun of our OR playlist, the music playlist, and like a bet, like, whoa, geez, you don't like my house music? What? Anyway, and we were trying to wake up the patient too, and she was like whatever. We were trying to wake up the patient that she needs to do, right? As the CRNA, we did the surgery, we finished, and now we got to wake up the patient, wheel him to the OR, the PACU, right? And as we're waiting, she made a remark like, God, this is not music I would listen to during the day. Maybe at the club at 1 a.m., but not the day. And I'm like, well, we're trying to wake up the patient. So she was like, yeah. Tree said, I'd really like to come to the U.S., and that's why Spain would be a secure path, then come. I don't know. I don't know if that would be a secure path. I think you should look into this a little bit more before you assume that. I don't know if it's a secure path. I think you're going to have to do school in dental school in the United States anyway. Connor Yamsek, that was a long time ago when someone asked about quitting after day one. Sorry, Connor. Julian Flores, how much do you start earning as an OMFS? 40% of what I produce. For example, Medicaid pays between $100 and $150 per tooth that I'll be removing at this practice. By the way, that's what teeth cost to come out in like the 70s and 80s. I'm serious. It hasn't changed since then. That's embarrassing. That's really bad. Insurance companies are pathetic. Okay, and then I get 40% of whatever that comes out to be after taxes. So it's probably maybe $25 to $50 a tooth if we're talking about just Medicaid alone. Julian Flores, how much? Oh, it's Carson. What's up, man? What's up, dude? Davey. What's up, Davey? He said pros and cons about Stony Brook. Pros, state tuition about Stony Brook Dental School. Pros about Stony Brook Dental School. In-state tuition, that's good. Small class size, a lot more hands-on experience, one-on-one time with faculty and attendings, right? Another thing is that great specialty match placement into specialties, okay? Cons, I would say that small class size, sometimes it can be hard to fit in if everyone's finding their friend group, but it's a small class, less friend groups. It might be difficult from the social side of that. Studying, study groups and stuff may be difficult, right? Another con would be it's all the way out there in the middle of nowhere in Stony Brook. It's an hour and a half to 2 hours from the closest city, Manhattan. Pretty nice, right? But some people, if you're from like a city area, you're out in the middle of the sticks. That might be hard to assimilate to that area. I liked it. I'm from out there in the sticks, but not everyone. That would be a con, I guess I would say. Stevie, are you already working? Not yet. Still waiting for my diploma, waiting for my New York State license. Said, do you have to make student loan payments right away? I don't know, and I wouldn't recommend trying to make loan payments in residency unless you have a significant other that's supporting the household or a family that's supporting your household financially. Like in residency, I paid for everything I wanted to buy, or meals, my rent, everything was based on my salary, and there was no room left over after that. I was literally negative the first 2 years. The third year I was about even. Last year I finished with like I think 4,000 more. Than what 4,000 to 6,000 more than what I spent. But yeah, the first 2 years I was negative. Like it's not enough money to live, especially in Manhattan. The price is up in Manhattan to live, breathe air, eat food, get groceries and stuff. Transportation is up here. The rent is way down here in Manhattan. Okay, so I just keep that in mind. All right, Victor Naysberg. What's up, Victor? How are you doing, man? Doing all right. I'm doing good. Here in Manhattan right now. I have a dinner with the practice at 7:30, so I'm going to be heading down to East Midtown, around like 51st, 52nd, I think. Milo, so if I'm right, you like a business, right? Solino Milo, if so, what procedures would you be focusing on? Oral surgery procedures, so extractions, wisdom teeth, sedations, implants, big implant cases, like bunch of implants around on one jaw, putting a denture on top of that. The sort of dentist puts down the denture, not me. Big surgery cases like that. You could do trauma in the hospital. You could go on to cancer surgeries in the hospital. Yeah, trauma in the hospital, that's a big one. Infections, managing infections. All the complications of all the other specialties come to us. Yeah, biopsies, looking at pathology. Abu, my D2 kid has to do 14 root canals on real teeth within the next 2 weeks. Nice. It's good practice. It can be done. That can be done. Yeah. As a D2, that's great. That's pretty early, I feel like. Because it's the beginning of D2 year, right? Davey said, are you accepting pre-dental students to shadow? I would love to come shadow you. Yeah, I am. I will be. Now, let me get my feet down on the practice first, since I'm only going to be starting in September. So maybe October, November? Yeah, let's do that. B. Airy said, what's the difference between the MD route and the 4-year route? Difference is it's 2 extra years in medical school, and you don't necessarily use that MD or that knowledge. It's great to have that knowledge base. You're an MD, you do that, but it's not using. So it's 2 more years. Most residencies make you pay for that tuition, so you have to pay for it too, in addition to those 2 years of time. The 4-year route, I'm going to be out 2 years early. I'm going to start working. We can do all the same surgical procedure, all the same oral surgery between the 4 and there's no differences. We do all the same things. So wouldn't you want to get out 2 years earlier and not have to pay for med school unless you go to, there's like, I know NYU, I think there's 1 or 2 other institutions in the US where the medical school's free. Maybe not. Maybe that's just financial help. I don't know. But Victor Naisberg, what type of stuff do you learn in dental school? Yeah, about teeth, Teeth, you learn about, everything. Our first year of dental school is with med school. So that first year is all medical school content, and then on top of that, we're taking some dental school classes, learning about the teeth, the anatomy of the teeth, dental morphology, and then you're working on teeth. You're starting to get used to doing fillings, the techniques, working on teeth like that. LOL. Victor Naisbury said LOL, but yeah. So that's what we do, and then the last 2 years of dental school is very hands-on with patient care. Okay, so it's like it switches. You slowly work with more and more patients. All right, guys, we're at about a little over 30 minutes. Yeah, okay. Just a couple more questions. Gizzy said, and by the way, the top 5 people that stayed on the live the longest, I'm going to be giving you guys, I'm recording this at the back, I'm going to be giving you guys a shout out in the caption of the YouTube and podcast, the full recording, okay? Gizzy said, is dentistry still a lucrative job as a general dentist? Yeah, it is still a lucrative job, yep. And I would hope that you like it too, so you're not dreading going in every day. That's a very important thing. Tree said, I'm entering year 12, and I'm in New York City for a week. Where can I meet an OMFS and international dentists? Maybe at NYU. I don't know if they'll let you in the building because it's the patient care going on there. Maybe though. Bieri said, okay, so you can do the crazy OS procedures in the hospital with the 4-year? Yeah. We could all the same hospital procedures. I could do whatever I want. As far as not whatever I want, but oral surgery stuff, yeah. D. Nice said, starting D1 in 2 weeks. Any advice you wish you knew entering dental school? Yes. I wish I knew to start using Quizlet right away. Quizlet with the figures, question, answer, ABC, and just repetitions immediately. That's what I wish I was doing then. Okay? Get my acid reflux. I gotta get my Pepsid. I've been having acid reflux since the last year of dental school, and I switch on and off between Pepsid and omeprazole. Omeprazole helps the best, but I feel like it's a stronger medication, so I try and switch back to Pepsid and then wean off. I'm down to 10 milligrams twice a day, but I'd really like to stop having to take any medications whatsoever, and this is a big thing. My acid reflux is just horrible. I don't know. One day, I think a lot of that has to do with the eating. We ate really late last night because we had to come all the way back into the city, and we got caught in traffic for 2.5 hours. So we didn't get back into the city until 9:30. We ate at 10:30, and I think that's it. Probably I get acid reflux all the next day if I eat after 8:39. I think that's the issue. Anyway, Victor Naisberg, what were your co-residents like? Co-residents, some of them were really cool. Some of them really were not cool. Some of them were jerks. And some of them were awesome. One of my best friends, I would say now, is I graduated with him. And yeah, some residents are awesome, and some people just don't get the bigger picture, unfortunately. Even at that age, in the 30s, which is pretty crazy, but it's true. Not everyone has self-awareness or situational awareness or social awareness, but that is what it is. Gizier said, how much do general dentists make on average as practice owners versus associate? Owners make more than associates. They also have a lot more responsibility, but you get to control that responsibility. You can delegate whatever you don't want to do, and you have to do whatever you want to do, right? So that's how that works as an owner. It also varies based on what location you are in the United States, right? So if you're in the middle of less populated areas, those dentists are generally making more than in the middle of center of Manhattan. There's more competition, but the reimbursement fees from insurance companies is even lower. And I think that is talked about a lot less than the fact that, yeah, it's going to be populated with other dentists there. There's going to be a lot more competition. But if you look at the reimbursement from insurance companies like Medicaid, for example, out in the middle of nowhere where the cost of living is much less, they're not paying in these areas. It's crazy. Insurance is the heart and root cause of 95% or more of all the problems in healthcare right now. And I still don't even think we're starting to talk about it a lot more. I still don't even think we're talking about it enough. We need to create a new insurance company. But D Nice, thanks, you got it. Herdero da Odonto, I'm a third-year dentistry student in Africa, Angola. We can do a live together to talk about the differences. We could. Which do you think has better ROI financially, medicine or dentistry? It depends on what you go into, like specialty-wise. It depends on how much you want to work. What do you want to do for work? You know what I mean? And then your quality of life, your work-life balance. It's going to depend on those things. For quality of life, I do think dentistry has a better quality of life. Those are my thoughts than medicine, right? But it's going to vary. There's some specialties in medicine that are outstanding, and they're going to win every time. So, all right, guys, I got to sign off. Wish you guys great rest of the week. Happy Monday. It's the 18th of August, 2025. TikTok Live number 72. And I'll be giving you guys a shout out, whoever stayed on the longest. All right, I'll be giving in the full recordings, the caption of the full recording on YouTube and podcast platforms. All right, friends, I'll talk to you soon. Thanks for hanging out.